Hello, everybody. On behalf of York Hospital, welcome to today's Zoom webinar. Today, we will hear from Dr. Marc Kaplan, Medical Director of Psychiatry Associates of York Hospital and Medical Director of Sweetser, about ways we can better cope with COVID-19 this holiday season and through the winter. Dr. Kaplan will share information with us for the first 35 to 40 minutes and then take questions at the end of his presentation. A few quick housekeeping notes before we get started. Unlike traditional Zoom, when you see everybody's faces during the meeting, during this webinar, you will only see Dr. Kaplan's face and his slides. As participants, your audio has been muted, so if you do have a question, you can type it into the Q&A button located at the bottom of your screen. Please do not use the chat or raise hand icons, as those will not be monitored during today's call. If you do ask a question through the Q&A feature and it is not answered during today's meeting, you can email us at info@yorkhospital.com and we will get you the answer after the call concludes. This webinar is also being recorded and will be available on the York Hospital YouTube channel in the next week. So now, once again, thank you very much for tuning in today and spending your lunch hour with York Hospital. We hope you find the information helpful, and we're pleased to go ahead and get started by turning the program over to Dr. Marc Kaplan.
All righty, thank you very, very much. And it's an honor to spend this hour with everybody. You know, we're all in this together, this pandemic, and managing stress and improving our self-care is something that we're all striving to do. So my first slide has to do with the concept of grief, because I'll mention this a bit later, but really all of us have had to face some sort of grief in the context of having this unprecedented pandemic upon us. So this quote, "Grief is like the ocean. It comes on waves, ebbing and flowing. Sometimes the water is calm and sometimes it is overwhelming, but all we can do is learn to swim." And we've certainly been swimming through this one. And it speaks to something that we've all had to develop, and that's, some resiliency. And this quote really speaks to that. "She stood in the storm, and when the wind did not blow her way, she adjusted her sails." And that's what we've all had to do. We've had to adapt. Now, think about what the last, 8 months has been like. It was back on March 31st, 2020, that Governor Mills issued that stay healthy at home mandate. And, we all remember what that was like at the beginning. Stay at home unless you had to go out for something essential, food, medicine, healthcare. We were allowed to go out and take walks, but everything really grinded largely to a halt. In fact, all hospitals had to really stop doing elective procedures. Now, it wasn't easy, but because, this quote really speaks to that. Nothing is so painful to the human mind as a great and sudden change. And, we found kind of a collective thing to focus on as a culture, and it was this. Now, I promise you, that's not my shopping cart, but I will say this, that I started working exclusively from home on March 15th. And the night before that, I finished up some work at Sweetser's Brunswick office. And I remember going to the Walmart later that evening and finding the last 12-pack of toilet paper in the store. And in some ways, I felt bad buying it, but I also knew, I better jump on the bandwagon a little bit. And thankfully, nobody I know really ran out of toilet paper. So we're now 7 and almost a half months into the pandemic, and I have to tell you, we have much to be proud of because we adapted quickly to these unprecedented changes that the pandemic demanded. But it's not been easy, though. And this is where I mentioned grief. This is where this comes into play again. Some people have lost loved ones during the pandemic. Some people have lost their jobs, their livelihoods. Some people have lost their homes. These are huge, life-changing events. Some people have had to postpone weddings or funerals or family reunions or graduations, opportunities and events that were really important and precious to them. Some people had to postpone their education. College students had to go on break. A lot of the colleges did finally come back into session, but many of them had a hard time initially connecting everybody virtually. Some people had to cancel much needed vacations. I remember I was going to take my daughter to Bermuda in March. And about, I'd say the last week in February, early March, I remember trying to call Expedia to cancel that trip. And apparently the entire world was canceling their vacations. And I remember putting my phone next to me while I worked all day and staying on the line for 9 hours to try to get customer service rep to help me with that. Now, when I say that it hasn't been easy on everyone, I just want to highlight this. And then, as promised, we're certainly going to talk about coping strategies as we move into the winter months. So there was a survey done, and these stressors are real. About 1 in 4 adults was having trouble paying their bills since the outbreak started. A third of folks needed to dip into savings, retirement accounts to just cover the bills. And, not everybody obviously has been able to work through the pandemic. And some folks that are retired were living off investments, and some of those investments tanked. We have 1 in 6 people that needed to rely on food banks to eat every day or borrow money from family and friends. Financial consequences hit the hardest, though, among citizens that already had low incomes, didn't have college degrees, and disproportionately, many of these folks were our Black or Hispanic Americans. Many folks, and I will highlight this again, the disproportionate amount of people of color worked in these lower paying essential jobs that they couldn't do from the safety of their home. So naturally, as they had to travel to work and work in nursing homes, work in food production plants, work in shipping factories, they ended up with higher rates of COVID-19. Now, I'm a psychiatrist, and obviously I took very great interest and had great concern about how this pandemic was going to affect my patients. And as I began to work with patients virtually, either in phone sessions with patients or video conferencing with those that can do it, people were experiencing the full gamut of symptoms, but many of them, one of the most common things was, and this makes sense, they were reporting escalating symptoms of anxiety and depression. So the CDC did a study a few months into the pandemic back in June, and they showed that there had been an uptick of like 40% in adults experiencing anxiety or depression. And the elderly were at some of the greatest risk, because the elderly that are certainly in nursing homes and assisted living, whatever their support system was, family that would come visit, activities that they would go to in the community, all that stopped. And if you all remember, it was really heartbreaking for not only for the elderly, but for the family members that wanted to come visit their elderly relatives. And the greatest emergency in psychiatry we worry about, of course, is suicide. And all of the data showed an escalated risk for suicide, especially among those who contracted COVID-19. And for those also with pre-existing conditions that made them more vulnerable to get COVID-19. Very, very frightening for people, very terrifying. As you know, again, this pandemic has caused significant stress to people of color who once again had to put themselves in situations where they were with increased exposure to the virus. And, just the isolation for many people associated with the stay-at-home order, adults, children, adolescents, that enhanced the risk of depression, anxiety, substance abuse, and thus suicide risk. So, Sweetser operates a crisis hotline. We operate something called a warm line, where if someone's not in imminent crisis, but they just really want to talk to somebody, those phone lines were ringing off the hook. And I remember we got a grant very early on in the pandemic to, increase the capacity with staffing for those hotlines, so we could really be available for people who needed the support. We also were part of an initiative to provide support to first responders and to policemen and policewomen and firefighters, people that were right on the front line of this, which took enormous courage, to go out and keep doing your job when all of a sudden your own safety was at enhanced risk. So we were part of a support line to help them. But there's been so many positive things, though, if you have that perspective, that have happened in the context of the pandemic. And again, I do not minimize at all the grief and the negative impacts and the fear that this has had on folks. But I would be remiss if I didn't talk about some of the positive things. So air quality improved because, especially in the first 3-4 months, we weren't driving as much as we used to. I used to drive probably 10 or 12 hours a week, going to the different Sweetser locations, going to York Hospital. I happened to play in a band and would often drive all over the state of Maine on weekends. I stopped doing all that. So, and everyone did. Air quality improved. What families experienced especially during the first number of months of the stay-at-home order, everybody slowed down. And at least people I know, and there's some studies that show this, family quality time was actually increased. For all the kids that stayed at home, it was very interesting. It's like it became the world's largest ever home economics class in history, because children were at home. They were learning life skills. They were learning how to cook. The homes got more organized. Kids, not all kids, of course, some of them hid in their room and played video games the whole time, but a lot of children engaged more with their siblings and their parents, and they took some more responsibility for chores. People got to spend more time with their pets. People weren't running off to work or running off to shop all the time, leaving their pets just hanging out at home. There was a lot more home improvement projects. That's one thing I can say, that places like Home Depot and Lowe's were considered essential stores, and people were ordering do-it-yourself materials for projects, and a lot of that stuff got done. So people developed new skills. And that's the next thing I say, people spent more time at home learning new skills. Obviously, everyone jumped onto this video platform way of socializing and communicating, and especially with family. And what was really nice about that, and I remember I have an aunt that lives in New York, and July 4th, believe it or not, it's her birthday. She turned 100. And her children organized a Zoom birthday party for her. And it was delightful because, up until then, I would call my aunt every so often on the phone, but I wouldn't see her unless once a year I'd go to New York and visit. And it was just so nice to see her and see everybody. And another real bonus was, we're so lucky we live in the state of Maine. It's beautiful. And the weather during the pandemic was really, really good. I mean, it was one of the most mild springs we ever had and an incredibly sunny summer. And so many of us went and explored the outdoors, Maine's beautiful parks, hiking trails, and beaches. So these are some, not a list of all the positive things, but there was a lot of positivity. So moving forward, we're going into the winter. COVID cases are rising, and that's, many of us expected that. Now, I will be the first to say, back in the spring when this was first happening, I didn't want to project this far ahead. I didn't want to begin planning in the spring, knowing that, the shelter at home kinds of things that we were all encouraged to do and mask wearing. I didn't want to think that it was going to continue into this winter. But I realized by summer, yep, this was going to continue. So, I started thinking back then about how am I going to get through the winter in ways that, will be energizing and keep things positive. So started to think about this. And the first thing, we know that one of the hardest things for folks is isolation. So what are some of the things that folks can do, especially during the winter? Because remember, for many of us during the spring and summer, we were outside a lot. We found ways to still connect with other people. So many restaurants began offering outdoor dining, and many of us enjoyed that and felt safe doing so. But as it gets colder, there's going to be less opportunities for that, although you'll see in a little bit, I'm going to encourage people to put on those layers almost year round, if it's safe to do so, and get out and walk year round. For those of you that live down in the York area, there's Kittery Trading Post, and they sell those, they call them yak tracks. There's different kinds of these little, cleats you can stretch and put on your boots or underneath your, whatever you wear when you go outside, and, be more stable on the ice. And again, I'm not suggesting everyone, go out and risk their lives by walking on the ice, but I will tell you that exercising and getting fresh air during this pandemic is going to be really helpful for people. But what about when you're inside? When I said before that how everyone's adapted, libraries have adapted, churches and temples and mosques, where they would hold religious study groups that you could go to at the church or whatever, whatever type of religion you were part of. But now they started offering virtual religious study groups. There are websites out there where you can join virtual courses, virtual adult ed, I'll mention in a minute. These are ways through Zoom or other platforms you can still connect with people. Now, there are essential charitable organizations and things that still have to run during this pandemic. So, for those of you that feel comfortable venturing out of your home, you can volunteer at a food pantry. You might go to the animal shelter and care for the pets there. You may offer to be a tutor in person in a school or via, virtual Zoom link. You might go to a hospital and be a greeter, or you may think about the nonprofit organizations that you really resonate with and offer to join the board or offer to say, hey, I'm a volunteer. Is there anything I can do? And, when I think of Sweetser, for example, so many of the tasks at Sweetser, the administrative tasks have moved virtually. And we've had volunteers now helping us virtually to sort through lists or to, prepare virtual emails, all different kinds of things. But however, I'm going to caution folks that if you are age 65 or over, or you have a pre-existing condition that lends you to be immunocompromised, I would encourage you to not go out and do face-to-face in the community volunteering. if you know, to avoid that, and find ways that you could be helpful online or virtually. Now, I mentioned going out for walks. If you know some people in your, you know, that are friends or neighbors, and you know they've been taking COVID precautions seriously, you might want to invite them to take a walk with you, or even share a home cooked meal, you know, as long as you know that they're not likely to expose you. You know, people that have been really cautious with, you know, wearing masks and appreciating the social distancing and washing their hands a lot. But what other self-care things can we do? It's really important to try to keep a regular sleep-wake cycle. With working from home, many of us are working from home now. And when you're doing that, there's a tendency to feel like you could just work all the time, because you don't have that previous cycle or rhythm of, you know, leaving your workplace or leaving your office and going home and not focusing on work. I can't punctuate enough the importance of exercise. When I mentioned earlier that people have experiencing escalated symptoms of depression, anxiety, exercise is medicine. I tell all my patients that, you know, Harvard has studied this. Exercise is medicine, and not just for psychiatric illness, but almost anything that ails you, but very much for depression, anxiety. It's really, you know, when I'm seeing a patient, I literally sometimes will tell them I'm prescribing anxiety or exercise for you, not anxiety. I'm prescribing exercise. And there's options we have now to do it even during the winter months. You know, I apologize to anyone out there that owns gyms and health clubs, but, you know, I know for myself personally, I'm not going to go to gyms or health clubs during the winter months this year. I used to go all the time, but I'm not going to do that. Instead, I'm going to do the walks, as I've mentioned to you. I've got layers of really warm gear that are going to help me feel warm, you know, enough to go out and enjoy Maine year round this winter. Some people ski. There's home exercises you could do. If you go onto YouTube and say you search for beginner yoga lessons or aerobics classes, it's incredible the amount of resources that are just on YouTube. And you can really learn stuff. If you like to dance, crank up music in your house and don't worry about looking or acting foolish. If you have teenagers, that's okay. You know, one of the jobs of a parent of a teenager is to embarrass the teenager. So, you know, you might find yourself posting you're dancing on TikTok or one of those websites. You can take virtual classes. Many of the adult education programs have also gotten on the bandwagon now of offering virtual classes. There's a very popular website called The Great Courses, and they're taught by world-renowned college professors from around the world. And, you know, you might have more time now to learn about things that you've always been curious about. Some people have been really learning music during the pandemic. And once again, you could support your local out-of-work musicians who teach music by engaging in virtual music lessons with them. Same thing with artists. You can take art lessons. And if you can't afford to pay somebody, once again, YouTube. There's a million people on YouTube that love to teach music and art and other things and offer free lessons. One of the things that many people did, when I said a lot of do-it-yourself home projects were happening, one of the things that I did, and many people I know, is I took the opportunity to be at home to declutter and downsize all my stuff. We all got stuff. And it's not uncommon in our culture because, you know, we're a privileged society. We have a lot of abundance. We get things all the time. And before you know it, I don't know about you all, but I couldn't, you know, I was having trouble fitting clothes into my dresser drawers. And, you know, I used YouTube and I researched, you know, I listened to some experts in organization. And man, I got out the, hefty big trash bags and I started tossing stuff into it that I know I'm not going to wear in the upcoming year or haven't worn for years. And it took a while, but then Goodwill opened up again. I think they started opening up and accepting donations in like end of May or June of last spring. So that felt really good to just declutter. As I mentioned before, families took on many do-it-yourself home projects. Lots of people built decks onto their house or repainted rooms. So these were all things that are important for, it's a way of self-care. We all feel really good when we feel like we're of value to ourselves or others. So those are important things to engage in as well. Let's talk specifically about the upcoming holiday season. This is really going to be a challenge for people because we cherish our rituals. We cherish our annual parties and ways to celebrate with people that we love and neighbors. If you think about the holidays, there are times when we want to get out. We want a Christmas carol outside with lots of people or share Hanukkah traditions or Kwanzaa, whatever it may be. We love to do those things. We love to go out shopping. We're kind of crazy. We would go out to Black Friday and line up at, midnight for some store that's going to open. I mean, this is what we do, but we really can't do those things in the same way this particular holiday season. So what can we do? Well, Thanksgiving now is a few weeks away, so I hope people have been planning already how to approach it safely. We really want to be celebrating with our household members only, meaning face-to-face celebrating, sitting around a table. And for those of you that don't have family members, those of you that live alone, if you do have family members that live close by, and once again, they have been serious about keeping themselves safe during the pandemic, it's fine to get together with them. However, if you have a really elderly family member or a family member that's fairly immunocompromised, don't pressure them to come. Don't pressure that you have to visit them. Okay? Let's keep them safe during this pandemic and, connect with them over the phone. For your loved ones out of state, please don't invite them to come into the state of Maine. And I would suggest that you all don't go traveling either. This is not the particular holiday season to do that. So video conferencing with extended family, is it ideal or optimal? Not necessarily, but is it the next best thing to feel connected with folks? Absolutely. We have college students that are returning from universities out of state. We really want them to quarantine for at least the 2 weeks they're home. Getting a COVID test when they come back is really not as protective at all as quarantining, because all the COVID tests will tell you is whether or not they were positive or negative right in that moment that the test occurred. But if they were exposed during travel, it can take a number of days before a test is positive. So regardless, we just want them, quarantining when they get home. It doesn't mean that they can't go out for walks and do those things, but let's not, encourage them to go out and hang out with their friends and, risk exposing people. Once again, when you're visiting your elderly relatives in state, or even if you do have to go out of state to see one, when you're with them inside, please wear a mask, okay? You may have to talk a little louder. I know my mother-in-law is 95 and she's amazing. She lives independently still in her own home. And she's amazing. I mean, I went over there a month or so ago. She had pulled out her air conditioner by herself. I mean, she's quite amazing. But what I've learned is every time I'm visiting her and I'm in the house with her, I'm wearing my mask. We need to avoid the tradition of work-related holiday parties. I know many workplaces are bringing their holiday parties virtually. People are getting together on Zoom. Um, Again, with holiday shopping, you know, we're gift givers. We love to give and receive gifts during the holidays, but let's try to shop online. We don't want to risk exposing ourselves to people that may have COVID by packing the stores. And this is a big one, I think. Avoid indoor restaurant dining. This is, during the spring and summer, for those of us that are, privileged enough to go out and eat, even into the fall. Again, it was a very mild end of spring and summer and fall. So many of us got to enjoy dining outdoors and places, but that's going to not happen during really within the next couple of weeks. It's going to start to get too cold, and most outdoor dining has stopped already. So please don't go into restaurants. There's a 4-time higher risk in contracting COVID-19 if you're indoors in a restaurant or a bar or a pub. But let's not forget about the restaurateurs that are struggling to make a living. So let's order takeout whenever we can. Let's support them. To conclude this part of the talk, I want everyone to know that we're all in this together, and it's normal for all of us to feel extremely anxious or depressed at times. So what are some resources for that? And especially if you're feeling that you're becoming moderately to severely depressed. So if you or a loved one are feeling potentially suicidal, please call the statewide crisis number. And the number's written there. And in the York catchment area, you would ultimately be connected to a Sweetser crisis clinician who can come see you even at your home or at your workplace, wherever it is that you need some support. Of course, in the time of COVID, they're going to try to do as much support for you over the phone as possible, but our clinicians are, geared up to still go to people's homes to help resolve crises. Of course, if there's an emergent risk of self-harm that you're experiencing, please call 911 or just go to your closest emergency room. If you're feeling depressed and anxious and you're not suicidal, but you're really, struggling, please talk to your primary care doctor. Many of the York Hospital primary care offices have Sweetser social workers connected to their practices. So not only can your primary care doctor help you, because believe it or not, the average work day for a primary care doctor, even before COVID-19, they spend about 30% of their work day helping people out that have primary chief complaints of anxiety and depression. And in the case of York Hospital, if your primary care doctor is, concerned about you and feels you need some additional help, they can refer you to therapists out in the community or to psychiatric associates of York Hospital who can be helpful to you as well. So at this point, a few more points. York Hospital has a wonderful resource called the York Recovery Center. We know that substance abuse problems for people has certainly escalated during COVID-19. We get very concerned about people that struggle with opiate addiction. There has been an escalation of unintentional opiate-related deaths in our state. They have increased anywhere from 20 to 30% because the social isolation and all those stressors make people that are addicted to opiates or alcohol more likely to use excessively. So talk to your primary care doctor if you're struggling with substance abuse issues, because they can refer you to the York Recovery Center. If you do want to find a therapist where you live, if you look at the website called Psychology Today, it has an extraordinarily user-friendly directory where you could filter, you can look for, if you want to see a male therapist or female therapist, you can filter for that. If you have a particular type of insurance, you can filter and find the therapists that are in network with your insurance policy. If there's a certain type of therapy that you want to focus on, you can filter by therapists that are trained in that particular modality. Now, if you want some support that you can access kind of 24/7, if you go to Sweetser.org, you'll see an opportunity to register for a free, confidential, evidence-based self-help tool called My Strengths. And it is a wonderful program with all kinds of modules for if you're struggling with substance issues, modules for sleep problems, modules for anxiety, depression, you name it. They have affirmations. If you feel like you're somebody that loves being inspired by affirmations, you can sign up for the affirmation a day. The My Strengths will send those to you. It's a wonderful, wonderful tool, and I encourage you all to use that. And with that said, I really, from the bottom of my heart, truly, and I can speak, I think, for the York Hospital staff that have helped us set up this particular opportunity for us to be together. We all wish you a happy and healthy holiday season, and I just can't punctuate the healthy part of that enough. And anyone who has questions or comments, this is the time to do that using that little Q&A icon at the bottom of your screen. So thank you so much for joining us. And I look forward to any questions you all might have.
Thank you very much, Dr. Kaplan. That was great. And thank you for reminding all participants that if you do have a question, you can type it right into that little Q&A button at the bottom of the screen. We did have a couple questions that came in advance of the webinar. And I've got one for you here, Dr. Kaplan, if you'd like to take this.
That would be great.
Okay, it says, everybody I talk to these days is stressed out, sad, and a little depressed about what is going on in the world. How do you know if it's normal to feel this way versus when you need to get professional help to feel better?
Absolutely. So let's start from baseline that, I would worry about somebody if they didn't feel some degree of anxiety and stress and grief during this pandemic, because it's collectively changed, our human experience. And a lot of people are anxious because of that unknown. When is it going to end? When can we resume life as normal? So let's just say that for somebody that's not experiencing very significant anxiety or depression, and the way we define that is if the anxiety and depression is significantly impacting what we call your functional level. If you're no longer able to enjoy the things that you used to enjoy, if you're, noticing that you're isolating more and your loved ones who, loves to talk to you, or even your household members that want to spend time with you, if you're, isolating too much, or if you're too anxious to even go out when you have to go out for something essential, that's when you want to maybe reach out for more professional help. Some of the things to help you cope with these feelings at home, staying on a regular schedule, making sure you're having meals, continuing to exercise. Some of us have enjoyed, spending more time, more casually dressed, but for some of us have needed to, dress up during the day like normal, just to feel like you're still in the rhythm of life. So these are some things to do to just, respond to those feelings of anxiety and depression, and, honor them, because a lot of times when we don't accept how we're feeling, it's hard to move on from them. It's hard to redirect your energy to thinking about solutions and engaging in many of the coping activities that we've talked about. Any other questions that have come in?
We do have another question here. I ended up in the hospital for an accidental overdose due to the stress of COVID. I feel I've upset people who now ignore me. How can I apologize or help them understand what happened? Thank you.
Okay. So first of all, I'm so glad that you're safe now and well, and you want to kind of, reconnect with folks. People, it's hard, and people need to understand and not stigmatize you, and not blame you for what you did. If you think about it, if at that moment in time, if you knew other ways to cope and other ways to manage, you wouldn't have taken that overdose. So what you can't do, though, is, you can't convince people to not be, upset with you. And it's really on them. I don't want you to blame yourself for that. What can you do? You can maybe provide them with some resources on what depression and anxiety is, and some resources on how a person who's a family member or loved one could help support someone that's been through one of these experiences. You can acknowledge and say to them, I'm so sorry that, I frightened you so much. I wish I hadn't done it. And, hurting you was something I wasn't intending at all. And encourage them, let them know, I'm safe now. I'm getting the help I need. So you can say those things. But what I don't want you to do is feed your anxiety and depression further by, one of the symptoms of depression is we feel guilty and ashamed, but we feel it like hugely elevated. So for part of your own recovery, I don't want you carrying too much of that shame, because these family members you're thinking about, or friends, again, they've got to own their response to the situation. They've got to own it. And they, in the best of worlds, will realize that, you weren't doing this just to harm them. And maybe they can celebrate with you that you're feeling better. So I hope that's helpful. Well, I guess I'll say one more thing about that. If you're in therapy, very often therapists are open to doing a family therapy session, or even letting you invite a friend or family member to the session, where a professional can kind of facilitate these difficult conversations. Okay. Anything else?
Thank you, Dr. Kaplan. We'll see if anybody else does pose a question. We have one other question that came in prior to the webinar. I'm nervous about my son. He's 14 years old, an only child, and a freshman in a new high school. School is mostly remote, sports have been canceled, and it's difficult to form new friendships in this virtual world. He's becoming anxious and has been having trouble sleeping. What can we do to help him connect with people his age and cope with this new reality?
Okay. So this is really important to talk about the impact that COVID has had on children and adolescents, because, it's been incredibly disruptive to their lives. And there is a link that I believe, Hillary, you can share with folks, that in general gives a number of ways that we can be supportive to kids in our community. Again, encouraging, as I mentioned, for adults, there's to do things with the local library. There's opportunities for kids to connect virtually with discussion groups and book clubs if they're into that, or video game clubs and that kind of stuff virtually, online. So that's an important way they can connect. We can still encourage kids to meet up and, go for walks outside. There are kids that love year round to, play ice hockey outside or go skating outside in safe places to do that. I'm not going to encourage kids during the winter to go to ice rinks inside, because enhanced risk to get COVID-19. We really want to, encourage kids to also socialize more with their family members. Teenagers think it's uncool to hang out with your parents and whatnot, but COVID-19 has proven that wrong in a lot of ways. During this shelter at home, families have gotten closer, but parents, it means too that you've got to, go the extra mile of extending the olive branch and finding ways to connect with your kids. For some parents, it has been learning how to play video games and spending time with your kids doing that, or spending more time watching movies at home or Netflix series that could be more meaningful to your child or your teenager, ones that normally you wouldn't maybe want to watch, but you're watching it to be with your kids, to enhance quality of that. Talk to your schools, because some of the schools are starting to offer virtual support groups for kids, or ways that kids can connect with their friends. And so, these are some ways to do that. Just, you think about all the coping strategies that I mentioned for us as adults, but many of them can be applied to kids. And lastly, if you're worried about your child, if you start to notice some early symptoms of, that start to blossom into severe depression, and what are some of the early things you can be concerned about? Once again, if there are things that your child or your neighbor's kid or your nephew or niece or grandchild, if there are things that that they really enjoy doing, but they're no longer taking interest in, and they're starting to talk more about more kind of morbid things and starting to mention, God, no one would miss me if I wasn't here anymore. These are all warning signs that you should be concerned about. If they start not eating as much, and you notice they're losing weight, if their circadian rhythms of their sleep cycle kind of start to turn around, and they start to end up, teenagers tend to do better anyway when they stay up later and sleep in a bit, and the pandemic has given a lot of them that opportunity. But if they start sleeping all day and blowing off school, and the virtual school, or the days that they have to go into school, these are red flags. And in those situations, you would really want to set up an appointment for a therapist, encourage them to go. And remember, a lot of these therapy appointments now are done virtually. So many therapists are offering virtual sessions. And if they do, it is important to, your child, if at all possible, to be able to do those privately, at least teenagers. For younger kids, parents really want to be part of those sessions. And don't forget our crisis hotlines, because all these crisis workers are very much trained to support people of all ages. So I hope that's helpful.
I think it was very helpful. We are going to be pushing out the video recording of Dr. Kaplan's presentation as soon as possible, hopefully by the end of the week. It will also be available on the York Hospital YouTube channel, and we will include, when we send out the link, we'll include a couple of these links that Dr. Kaplan has referenced, with some useful tools for people to consider in the next couple of months as we all go through winter together. If you have any last-minute questions for Dr. Kaplan, feel free to put them right there in the Q&A button. Otherwise, thank you very, very much for joining today's call, and thank you, Dr. Kaplan, for being our presenter.
It was a pleasure and an honor, and I wish everybody a really, really safe but also fulfilling winter season. Thank you.
Thank you very much.